Hi, my name is Caitlin Hudson, and for my second case scenario, I will be doing it over pyelonephritis. I'm not sure if I'm pronouncing that right. I've tried dozens of times, but some of the learning objectives that you'll get from this presentation is that you will be able to understand the normal function of the kidneys, understand the disruption of the kidneys that causes pyelonephritis, and be able to identify the causes and the symptoms of pyelonephritis. A brief overview of pyelonephritis is that it is a type of kidney infection that begins in the urethra or the bladder. It's caused by bacteria entering within the urethra or within the bladder and then going upstream through like your ureters and everything and going into the kidney. It can be worsened if no treatment is taken and can lead to hospitalization. In the picture to the right of the screen, you'll notice that there's two types, acute and chronic. So acute is a sudden development, and then the chronic one is a long-standing infection that can result in kidney scarring. So to kind of list out how your kidney should work, unfiltered blood goes into the kidneys to be filtered through your renal parenchyma, specifically the glomerulus, to get rid of waste that will then be excreted through our urinary system. So if you look in the picture to the right, you'll see that unfiltered blood goes into the kidney, and specifically it goes into your renal parenchyma that has your glomerulus in it. The unfiltered blood goes through your glomerulus and gets filtered through. So then the clean blood goes back into your venous system, while the rest of it, whatever needs to be excreted, goes through the yellow duct in that picture and eventually goes through your urinary system and gets excreted as urine. So, pyelonephritis damages the renal parenchyma section of the kidney, so where that glomerulus is and your nephron loop and everything that's associated with that region. It modifies and filters the content of what should and should not be going into the urine to be excreted by the body. So like we want to keep our water content in our body if we need it. We want to keep our enzymes. We want to keep our amino acids. We want to keep our albumin. We don't want to keep necessarily like metals or bacteria or anything like that. So that's kind of what's going to be excreted. And if that's not being excreted by the kidney, then that means that one, it's getting put back into our bloodstream, and two, it's going to also infect the kidney, and the bacteria will get into the kidney and affect it that way as well. So you could also say that the renal parenchyma is the functional part of the kidney that includes the renal cortex, the outermost part of the kidney, and the renal medulla. So the renal cortex contains a bunch of nephrons, which also have glomeruli, which are the primary filters of the blood passing through the kidney. And so the bacteria from the pyelonephritis affects all of the nephrons, all of the glomeruli within that renal parenchyma and within the renal cortex. That then damages the filtering system, which then damages the kidney. So some symptoms of pyelonephritis is fever, backside pain, abdominal pain, burning sensation when urinating, cloudy urine, nausea, and vomiting. So you'll see, like with fever, you get a fever due to the infection, so your white blood cells in your body is trying to fight off the infection, and that induces a fever. Your kidneys are primarily felt whenever there's pain in them on your backside, so it makes sense that there would be pain in your backside on your lower back due to the inflammation that the infection would cause. And also the bacteria within the ureter would cause inflammation lining the urinary tract, which would cause the irritation when urinating. So these are all my references. I have 3 references, always the Mayo Foundation. They just kind of line out everything really easy and simple. And if you have any questions, just comment down below. Thank you.